Hello everyone. Let's look into the anatomy of the respiratory system today. First, let's read the question. A 52-year-old man comes to the physician because of a persistent chronic cough producing a copious amount of mucus for 8 months. He has been smoking 2 packs of cigarettes daily for 20 years. Which of the following cells is most likely responsible for this patient's mucus secretion? A. Alveolar macrophages, B. club cells, C. goblet cells, D. pseudostratified ciliated columnar cells, E. type 1 pneumocytes. We will be covering histology and gross anatomy. The respiratory tree is divided into two parts, the conducting zone and the respiratory zone. Dividing helps in understanding the function and histologic morphology of each segment. The conducting zone provides a passage to the air we breathe in, whereas respiratory zone is involved in the exchange of gases. Here are the main epithelium lining the respiratory tract. It starts with the pseudostratified columnar epithelium with goblet cells in the nasal cavity and transitions to simple squamous epithelium down to the alveoli. This image shows the entire respiratory tract histology and is a great visual demonstration of the various cells involved. Let's look into some of the important cells. It is vital to remember the extent of these cells, especially where they cease to exist in the respiratory tract. Note that ciliated cells are lined with cilia to aid in the sweeping action for removing trapped particles and move mucus. They terminate in the respiratory bronchioles, which means they are present in the segments before that. Remembering the sequential gross structures in the conducting and respiratory zone will help in understanding the transition of cells. Goblet cells secrete mucus and terminate in the larger bronchioles. Club cells are present in the larger bronchioles and terminal bronchiole and secrete granules containing surfactant and detoxifying enzymes. Type 1 pneumocytes are present in the alveoli and form 97% of their surface. They facilitate in gas exchange. Type 2 pneumocytes are present in the alveoli scattered among type 1 pneumocytes and produce and secrete surfactant from lamellar bodies. They also participate in the repair of damaged epithelium and give rise to type 1 cells. Alveolar macrophages or dust cells are found in the respiratory bronchioles and the alveoli and are involved in phagocytosis. Here is a figure to remember the extent of certain epithelia and cells in different parts of the respiratory tract. Make sure to take your time and go over these points. Note where the goblet cells, club cells, cartilage, and smooth muscle fibers are and where cilia terminate. Coming to today's question, a 52-year-old male smoker presents with chronic productive cough. Which cells are involved in mucus production? If you have reviewed today's information carefully, mucus is produced by goblet cells which undergo hyperplasia in smokers. Feel free to pause the video and go over the answer explanations. It is best to read thoroughly for better perspective. Here is the key point. Thank you for listening. Keep calm and follow the drone. Don't forget to like, share, and subscribe.